in crisis mode, as you know, and bordering, if not already, in disaster mode.
That's the warning from our state's hospital leaders tonight. They're saying they're up to 300% over capacity due to a surge in respiratory illnesses among kids.
Fox 13's Hannah Kim has been tracking this for us. And Hannah, what are hospital leaders saying about this huge increase?
Yeah, David and Jamie, hospital leaders are asking families, especially with little kids, to be vigilant. Right now, they are already stretched thin to make sure sick kids get treated. And the big concern is that things could get worse.
Our ER is at 100% capacity, almost 24 hours a day, and in the evenings up to 300%.
They've never seen it like this. We are seeing our highest ever admissions for RSV.
RSV and the flu have our hospital leaders saying they're scared.
We're terrified that we won't be able to take care of all the kids.
They say Washington only has 500 pediatric beds, and only 22 of them are in the ICU, with 1.5 million kids statewide.
But I have an awful lot of very sick children.
So they're making adjustments.
We now see patients in hallways, in and outside the ED, in the storeroom, in several lobbies.
We're assessing other elective units in the hospital, like a sedation unit, how we can use that space for more bed capacity, is offer incentive pay for nurses and staff who take shifts, getting them the right privileges and credentials to help see some lower acuity patients in our ED.
Our hospital leaders say this is going to be a rough time for families.
It could be scary and confusing for parents.
They're asking folks at home to make adjustments early.
And if you're sick, try to stay away from other sick kids.
Washing hands, covering coughs and sneezes, staying home when you're sick. I cannot re-emphasize that enough.
They want parents to know the reality of RSV.
Almost all kids will get RSV at least once before they turn 2, and a very low percentage of that need hospital care.
But remember, this virus can spread on surfaces.
Doorknobs and our toys and our binkies and things like that. So trying to have families not share those things and recognize that there's a lot of opportunities at home to perhaps prevent the spread within a household.
They also want people to remember that a major defense we had against COVID is no longer a thing.
Masks are no longer required in school, but it is certainly an option to wear a mask.
They're pointing out that a lot of little kids have never really been sick before due to the precautions we took during the pandemic.
Kids not getting these viruses over those first 0, 1, 2 years for the past few years has changed their susceptibility. So they're just getting it more, and there's more of them getting it faster, spreading it to each other because there's more vulnerability, less herd immunity.
Our hospital leaders are now begging families to protect themselves.
I don't think folks get this. I think people are so tired from COVID and they don't understand the urgency of what we're talking about. We need to flatten this RSV curve.
And pressuring local jurisdictions to help make flu vaccinations more accessible.
The schools have shot clinics for COVID shots. Hardly any of them have flu shots.
Especially since enthusiasm for vaccinations is at a low.
The vaccine hesitancy that came out of the COVID pandemic spread to other vaccines for children.
And the holidays are right around the corner.
If people are sick, they should probably not join in the holiday celebrations.
I'm actually terrified about what this can look like a month from now.
Now, all of these hospital leaders stress that you should take your kids to the emergency room if you think there is an emergency. They went over the signs they look for with RSV, including respiratory distress, seeing muscles move in the rib cage, nasal flaring, breathing hard and fast, a nighttime cough that just keeps getting worse, and for little ones, just not eating or drinking. They're asking parents who see more normal coughs and fevers to go to their primary care physician, adding that telemedicine should cover that level of illness as well. Jamie, David?
All right, Hannah, thank you.